Today, Alzheimer's affects nearly 6 million Americans, and that number is expected to nearly triple in the next few decades. Here to talk more about brain health is Dr. Yvonne of Valley Oaks Medical Group, a contracted provider for Optum Care Network, the sponsor of this segment. Doctor, thank you so much for being here.
Thank you.
June is Alzheimer Awareness Month, also brain health. And I think there's probably very few people that aren't affected either directly or indirectly by Alzheimer's or some form of dementia. It seems to be more common.
Yes. Alzheimer's is probably the commonest one. It affects 30 to 40% of all Americans. Probably 15% is from cardiovascular dementias, and then there's something called alcohol-induced encephalopathy that will also affect a certain number of people over 65.
Yeah, and it's a little disconcerting to know that that could be happening to a loved one or to yourself. How do you know the difference between forgetfulness and growing older, and maybe a lesser form of dementia and Alzheimer's?
So forgetfulness, it happens to all of us as we get older. One of the things that you and I will do, we'll put a set of glasses on our head, we're looking for them through the house, all of a sudden you see yourself in the mirror and you go, oh, there they are. Someone with dementia, especially Alzheimer's, will go, what is that on my head? They won't be able to recognize the object.
And there's a natural tendency to try to cover that up.
Oh,
in some
yes,
ways,
for
right?
sure. And people will deny it. They will get depressed over it. They may hide that they're depressed. And they also get very aggressive. They'll get angry with their spouse. They will yell at their child for trying to make them feel like there's something wrong with them. And one of the things that they're really afraid of is having their freedom taken away. Their driver's license, being put into a nursing home, losing their ability to be independent. And that's early stages. That's one of the big things that we look for. Understandable
concerns. So what can be done? Let's start with people who have been diagnosed with Alzheimer's. There's no cure per se.
There's no cure. We can slow it down. There are certain medications that we use that can slow it down, but we can't ever stop it. We can decrease the progress of it. Certain things you can do is definitely have good nutrition, stop smoking, don't drink. Don't drink more than 2 drinks a week of alcohol, get out and do some exercise, but some of the more important things are have a community, have people you can go out with. Make sure that you keep in touch with your friends, you take care of your neighbor in some way so that you have a sense of community. That is a big factor in it as well.
What about preventative measures? You hear things like antiperspirants or other factors could come into play. Is that true? And are there things that we can be doing to keep our brain sharper, maybe avoid Alzheimer's?
Alzheimer's is hard to avoid if you are genetically predisposed to it, but things like additives in our foods, things like you said, like antiperspirants that may have aluminum or other harmful products in it. Keeping up with making sure that you have the right type of vitamins, like B vitamins, is really important in your diet to keep up as well. And getting out to exercise every day. It doesn't have to be strenuous. You have to have a gym membership, but go out and walk. Enjoy the sunshine. Do a little meditation. Listen to music, especially classical music where you have to kind of identify the violin versus a trumpet. Those kind of things are important. Do crossword puzzles. Do Sudoku if you like that.
Exercise the body and the mind.
And the mind,
yeah.
Yes, for
Doctor,
sure.
Thank you so much, Dr.
You're
Berry.
welcome.
Appreciate you being here
Not a
today.
problem.
We want to thank Optum for sponsoring this segment. For more information, you can call the number on your screen or visit optumcare.com/Nevada. We'll be right back.